Yeah, look, we always knew as we opened things up, we'd get additional cases. On the one hand, we are still the lowest per capita positives, cases, and deaths in the lower 48. But every increased case is concerning. And it just underscores that this virus hasn't gone away. And it's how we as Montanans act and react, which will help mitigate any further spread.
Did you were you surprised to see like we call it a record number of cases, 56 I think it was yesterday. Is that's a high threshold number for us you think on dailies?
Yeah, like we always have to keep it in perspective by population. If we were Arizona right now, we would add 645. But it's a big number of cases. Now, part of it, look, we've increased testing, we've changed testing protocols. Now, if we even find one positive, we test everyone in their circle instead of just requiring them to quarantine. But it does demonstrate. Every time I get one of these reports, I have concerns because it demonstrates that this virus is here. And we've got to take those actions like social distancing, like sanitation. Businesses have to take this seriously because we don't want to get to a point where we're taking steps backwards.
Um, we're in phase two now. We have more people together. That I think was a relief on June 1st for most of the people in Montana. That includes weddings, family gatherings. We got holiday weekend coming up. We have bars, restaurants, meetings that are including more people. So without strict directives, will people in Montana cooperate and do what you've directed as the right thing to do in phase two?
Well, I think Montanans took this seriously, and that's what got us to the point of phase two. I mean, certainly we shut down our schools and a stay-at-home order before the majority of states. There's a difference or a reason why South Dakota's example has 10 times the number of cases that we do. It wasn't just because of my directives, it was because Montanans took it seriously. So as we go into holiday weekend, as we're seeing more transmission through larger gatherings and weddings, look, we're all tired of this. We wish this wasn't there, but we have to maintain our vigilance, and Montanans have to continue to take it seriously.
One of the things that has turned out to be a somewhat of a controversial issue and a lot of talk about it right now, all the way up to our chief executive, is that the wearing of masks. Um, Thoughts on why this turned somewhat political and whether or not there's a gray area in wearing masks?
So I was on a call, all the nation's governors were with the vice president and Dr. Fauci and Dr. Birx and the head of Health and Human Services just yesterday. And it was even Republican governors saying, we need to hear more from the administration about the importance of masks. Look, the virus doesn't care about your politics. It doesn't have projections. It doesn't care. It's an unthinking thing that wants to multiply by getting into our bodies. So we do need to take it seriously. The masks that we wear are protecting everyone else from us. And we know that the chances of transmission are much, much less likely in wearing masks. Not asking people to wear masks when they're running on a trail or all alone, but it's just where social distancing isn't possible. And what we've seen in many other states, like you look at Florida, Arizona, Texas, they're shutting down their restaurants, they're shutting down their bars, and they're requiring the wearing of masks. Montana businesses and Montanans need to take this seriously so we don't take the steps back.
I'm having a hard time understanding the vitriol, the real hardcore folks that don't want somebody to tell them what to do, like wearing a mask. Can you sympathize with them in any way? Do you understand their argument? Or
Well, I think, look, we as Montanans, we like our freedom, we like our liberties, and we can maintain those freedoms and liberties, but recognize that the mask that you wear might be protecting literally your mother or your grandmother. And it's a small step to take. And it is unfortunate that in some ways that this has become politicized because, as I said, you know, the COVID doesn't care if you're a Democrat or a Republican or a Libertarian. It just wants to spread. And it's the actions that Montanans take. Montanans have always been so good at, we care about our neighbors. And we'll do anything for somebody down the street. You know, we'll dig them out of a ditch during the winter. We'll mow their lawns. And this is just a way that Montanans can certainly take care of their neighbors.
Okay, July 1st. Just, I mean, I can't even believe we've already hit
Isn't
the
that the
end of June. I mean, schools are only a few weeks away from being back in session with what we know today. Can we safely open schools into in-class learning in just a few weeks?
We can, and it'll look different. We'll be rolling out, hopefully, within the next week, some guidelines of what schools should be thinking about as they look toward a reopening. Now, it's an individual district's decision, but we've got to recognize that we could be with this virus for quite some time, and we've got to provide services that our kids and our communities need and learn how to live with it differently. Now, school might look a little bit different. More social distancing, less going from class to class, and maybe teachers going from class to class, taking different steps along the way. But we have to work together to make sure that we do actually address these issues.
You obviously know with your position comes great responsibility, and I know you didn't ask for the pandemic, but the decisions that you make have a great impact on people's livelihoods, their businesses. You've got safety of families' health on the decisions that you make. Tell us about your guideposts. What are you using both personally and then people and policy around you to make these decisions?
Yeah, and throughout this, we said first this is a public health crisis, and we have to have public health actually drive it, saying how can we be most protective of people and get our hands around this virus. And that's the reason why Montana is among the lowest in the country. But it's a real economic challenge too. And I can look at the actions that we took early, not only made it so that the virus from a per capita and actual percentage was among the lowest in the country, but that's also what led us to the point where we had the third fastest employment growth last month, or the seventh lowest unemployment rate, because more Montanans are getting back to work as a result. So we'll wake up each day saying, what's the right thing to do from a public health perspective and from an economic perspective? And I don't think the politics should be getting into any of this part.
Who's been your chief advisor?
So, I probably talked to Dr. Greg Holzman, who's the state's medical officer, more in the first couple of months of this than I was talking to my family. And in addition to Dr. Holzman, it's the epidemiologists and the Communicable Disease Bureau at Department of Public Health and Human Services. Your local public health director, John Felton, has my cell phone. I have his. I've been talking to a team not only in Helena and having the Adjutant General and Disaster Emergency Services running a lot of this, but talking to folks all across the state, and then talking to people on the economic side too. I mean, this morning I was on a telephone call with a tavern owner in Bozeman as we're saying, how do we actually get it so that employers are making sure that their employees are taking the precautions necessary?
What do you think is more likely through the summer? We continue phase 2, we roll back to phase 1, or we transition to phase 3?
So I certainly hope we don't take steps backwards, at least statewide. You look at Bighorn County as an example, put in more restrictive requirements than what I've done at the state of Montana. And I encourage local communities to exercise that when it's appropriate. I don't want to go back, take steps back, but that's not dependent on me. It's dependent on two things, one of which the virus, and second of which how we as Montanans act and react. I think with the cases that we're seeing and the spread, like I'm not looking at a phase 3 certainly yet. We'll just continue to monitor both what the disease is doing and how Montanans are acting.
I think it worries everyone, the idea of going back to phase 1, and I'm sure it does to you.
Yeah, I have zero desire to take steps back. Now you can take a look at Texas, Florida, Arizona. All this week literally took significant steps back. I am heartened by we have incredible local public health people working. Like every time we see a positive, on the one hand, it's concerning, but it's also because the contact tracing we're doing, it's making sure that that next positive isn't spread. I'm heartened by the Montanans, individuals and businesses that are really taking the steps to try to make sure that the virus doesn't spread. And I think all Montanans are in this together, and we don't want to take steps back, for sure.
Testing, are you satisfied with the progress? I mean, a couple, I can't remember at which press conference you mentioned something like 60,000 tests a month is where you'd like to get. We're certainly not there.
Yeah, I'd set a goal of up to 60,000 tests a month. The last couple of weeks we've done 12,000. I'm pleased that we've both tested our nursing homes, some of our secure facilities, a lot more tribal nations, so dealing with the potentials of vulnerability, but getting it out more so that there's more wide open and drive-through testing so we can also find the asymptomatics as well. We'll continue to push to make sure that folks can get tested. I'm pleased with where it is. You know, there was just I think a report that came out this morning that there are only 4 states that are testing at the capacity that they should be, and Montana's one of them. But that doesn't mean, just like all the other facets of this, you know, we can't either take steps back or lose the vigilance on it.
In the governor's office, do you get tested? Does your staff get tested?
So in the governor's office, we do temperature checks every morning for everybody coming in. I have not been tested throughout. Now, initially it was because there was a time through this, like we forget, where testing supplies were scarce and it was difficult and certainly didn't make sense at that point, and haven't had the need since then or throughout. But it is one where I really encourage, if people have any symptoms, to stay at home, get a hold of the medical provider and get a test. And if there are concerns along the way, to certainly ensure that you get tested.